The Business Owner's Journey. I'm Nick Berry, and I've got real business owners telling their real stories, sharing their real lessons and strategies, so you don't have to figure it all out on your own. Josh Fertel is the founder of J3 Revenue Cycle Management, a company helping medical practices increase cash flow and take control of their financials. When Josh was in his early 50s, after he'd been successful in the automotive industry for several decades, he left that industry and walked away to build something new, only to face a cancer diagnosis almost immediately afterwards. Instead of retreating, he reinvented himself, started another company, and built a national healthcare billing company from scratch. In this interview with Josh, you can expect to learn how revenue cycle management determines private practice survival, what physicians misunderstand about healthcare cash flow, Josh's take on AI in healthcare and revenue optimization, whether private practices can win in the insurance sandbox, how to build trust-based client relationships that drive retention, and how he's grown a national company using word of mouth instead of advertising. Enjoy this episode with Josh Fertel. The first thing that I heard about was how nice of a guy you are and well-spoken and an excellent writer, like why your content resonates with people, which these things have all proven to be true.
Thank you.
But then I learned about your story, and I think the word resilience is definitely something that comes to mind. It's an interesting sequence of events. I think you're in your early 50s, decide that you're going to transition out of a multiple decades career that you'd had a lot of success, start a business.
Right.
I mean, kudos for that. And then you're diagnosed with cancer.
Correct.
And here we are. So tell me about your mindset as you went through that. Like, how did you navigate all of that?
It's you come to some point where the people that you're surrounded with influence you in different ways. And for me, it was when I got remarried, and my second wife, she, I have to say, she thought that there was more to me than just working in a car dealer. And that's the easiest way I can probably put that. And she said, you have to go work for yourself. Besides the fact that she hated the hours I was working, she said, let's just see what you can do. And so I left, I just, cold turkey, and started the auto brokerage and did very well, built myself a nice book of business, and was working from home and, different kind of stresses, but I was able to spend a little more time, with family, and it was great. I loved it. And what happened was when I had my surgery for cancer in 21, it wasn't that I was looking to leave and stop doing it and start doing something else. Although I was starting, 30 something years in the same industry was starting to bore me a little bit. Let's put it that way. So I wasn't looking to change anything, but I wanted to spend the time that I was going to be recuperating to learn something new. And the reason for this is that many years ago, I was going to go work for AutoNation in Weston. They were just building their building, and it wasn't going to be open for an extra month. So I had a month off, and I wasted the time. I really did. I think I paid in my daughter's room and sat around and ate and put weight on, and I promised myself I would never do that again. So, fast forward 20 something years, 25 years, 21 years. And I was like, well, this is the opportunity is going to be here again to just sit around. Am I going to do nothing, or am I going to learn something new? And I just decided to learn something new. I've always been interested in the medical field. Definitely too old to be a doctor and go to med school. But since I was in the business world for so long, I was like, well, let me learn about that side. And that's where I started, picked up my computer and took a class on billing, and it went from there. It was let's just say, an accidental change. And COVID at the same time did affect the car business a lot. So I had extra time to work on it as things were a little bit slower, but I wasn't changing on purpose.
Yeah. At a certain point, though, something was triggered in you that instead of you being maybe nudged toward this in this direction, but you decided you were pulled, right? At what point did you realize there's a problem that needs to be solved here and I can solve it?
It took a little while, right? There's certainly a learning curve to it. I surrounded myself with a team that had a lot more experience than I did, 10 and 15 years. And as I'm speaking to business owners, which is private practice, they are business owners, the lack of education in how to run a practice was really starting to dawn on me. And I had the ability to look at it through a different lens, and say, okay, well, I've literally ran multi-million dollar businesses. You say, well, that doesn't sound right. And, I can have a conversation in 5 minutes. It's like, the math doesn't seem to be working here. And you just pick it up and just be suggestive. And I think that a lot of that has helped with the growth of the company to be able to say, okay, we're not just going to sit here and submit your claims and code them and hit submit. We want to see you grow. And I think if you do these couple things or cut this here or hire somebody here, that's going to help you grow. And in return, we're going to get our percent. We are partners in the business. So that's kind of what I saw. But it's a shame that these providers go through so many years of school and certainly leave that school with debt, and not once are they taught how to be business people.
Yeah, it's like the system's not really designed for them to be doing
Right.
it in private practice. It's for them to be part of the system.
Right. So, you go along and you explain what receivables are and where to find them and what to look and what questions to be asked and ask questions of us as your billing team. We're the engine, we're the cash flow, we're the engine of your practice. What questions do you ask? What things should you be looking for in your office and outside of your office so you can run a business and be profitable and succeed?
Yeah, it's remarkable I mean, especially in the field that you're in, the clients that you work with, they could be so sophisticated and advanced in certain elements and still have like such fundamentals missing in other
Right.
areas.
Right. And they don't know a lot of times what they're missing, right? You don't know
I
what you
mean,
don't
none of
know,
us do, right? We don't
right?
know, we don't know.
We don't know what we don't know. Why is it like that? And I have providers that have been 25 years in the business that still ask basic questions. And it says, wow, gosh, why is it taking 25 years for you to know that? Or why does it take 25 years for somebody to explain it to you even better? And I feel good when we get our point across. And because everybody's getting aligned, everybody's on the rails together.
So you kind of maybe got nudged in this direction. Then you realize there's a problem that needs to be solved. I can solve it. At a certain point, like you got traction with it. And now tell me about what this has turned into.
Well, I found that first thing we have to do is provide the information to our clients. So a lot of times you billing company at the end, any billing company at the end of the month will send a report. Here's what we collected. Here's what's outstanding, and the provider will look at it. Maybe they'll know kind of what they're looking at or what they're not. Anything with billing, we your claim is 2 times to 2.5 times what you're really going to collect when you're submitting the claims. So when you see a receivable number, it's not really what your receivables are. It's a fictitious number. And you can make that anything depending on how much you want to set your claims for. So what's the real number? What am I really missing? What is it that I'm waiting for to come in? So we could send a report, and there are billing companies that'll send a 10, 12-page report of what happened for the month. Honestly, as well as I do, that's not getting read. Nobody's looking at it. They'll look at the first page and they're going to put it aside, and then the coffee cup's going to go on top of it, and then it's going to go in the garbage a few days later. It's never going to be read. Every practice has an EHR. EHRs really came into the forefront 2008, 2009. They have not been around that long, but there's been no renaissance in them. They're
And
still used.
EHR, I'm sorry,
Electronic health records. You go to the doctor, the information they're typing into the system of what they've done, what's wrong with you, what needs to, how they're going to fix you. That's your electronic health record. And every practice uses them. It used to be on piece of paper early in the 2000s. They were still using those big folders that you saw when you walked in that are coded. In 2008, 2009, under President Bush, President Obama, they really pushed and paid hospitals to go electronic so that data and information can be shared. Fast forward, 17 years, and all really it is now is still data being put in for a patient. Reports are in them. They all have reports, but finding those reports and finding the information for all this data that's being inputted to use to run a business is near impossible. And I think I'm okay saying that. And you're paying a lot of money for this. Practices pay a lot of money depending on the system to get this information. So what I came up with the idea of, let's take the billing part, let's put the business part in front of the record. And so when I'm a provider and I log in the morning, my financials are sitting right there. The things that I need to know: what claims haven't been paid, what's getting old, what patients are coming in that are going to have to pay their copays today. So I make sure that we collect them. Not to go on a tangent, but patient responsibility is almost 25% of the income, and it's neglected. Front desk is just such an important part. Let's keep an eye on them to make sure that they're trained, right, to do right, and that they have buy-in in the practice and they appreciate the service that the practice is giving to their patients, so that they understand that patients have to pay, and the patients know they have to pay, but you have to ask them. So let's get that information there. Let's, what's in my account? What's my cash flow look like? What are my expenses? All these things, let's just put it front and center with real information, real numbers, with traffic lights, nice and easy to understand. So in the morning, provider knows where they are, business owner knows where they are. They can look at it really quick and then get on with their day. There's the second part to that. Well, actually, let me go back. The most important thing about the EHR that we're creating, Forward EHR, is that we're going to give it away for free to the providers. It's not going to be a subscription model. As the billers, we're going to it'll be monetized by us doing the billing, uh, and a couple other things that we're going to do. But there'll be no subscription model, and that could save a provider from a couple hundred to a couple thousand, depending on the size of the practice. You shouldn't have to pay to find out how your business is going. You shouldn't have to pay for that information. It should be given to you, right? So many things, technology is free. Google's free. Facebook's free. All these things are free, and they make their money in other ways. Let's do this for our providers. Let's not burden them with something new, and let's help
Hmm.
start them. A brand new provider, it's one less expense that they have. Giving it away, that's the biggest part of that.
They can cut some of their cost of operating, but then they're at the same time, you're able to help them increase the top line. And then the scope of your services, have the scope expanded now? Is it broader than financials? And now you're getting into helping them run their operations, or maybe even broader than that, like we're wall to wall business.
I always believe that every inch of a practice or any business needs to be generating income, right? So if you are, they're all, if you're brick and mortar, what are we doing? How can we use this space here to generate income and generate revenue for the practice? So I always look at things like that when I'm having a discussion. There's so many services that can be provided, ancillary services for a practice, whether it can be chronic care management, which we do, advanced patient care that we do. You can do pulmonary services. You can do allergy services. There's so many things. A lot of them are cash pay too. Medical marijuana is a big thing now. If that's something that you want to get into. So many ways you can increase the top line that you just don't know and you don't think of. And so when I or somebody like me can come in and say, here's an opportunity, what do you think about this? Let's have a discussion. I'm not benefiting from it, but I will in the long run. My company, if my practice, if my clients are doing great, we're going to do well too. It just trickles down. So I want to I want to, feed up whatever can help them. One of the things that our new software is going to do is, when you're with a patient, AI, we're going to right now, AI and Epic, who is the godfather of all electronic records, says we're going to use AI, and AI is going to help with coding and is going to help patients with scheduling. I just saw a video about it yesterday. All right. So my first thought about that was, okay, so AI is going to help with coding. So what we're doing is we're eliminating every medical scribe. That whole industry is going to go away. It's just not going to be needed anymore. It's going to be affected. And we're going to help patients schedule. We're going to help patients schedule their appointments. Okay, great. How is that helping the provider? I can't figure it out. Right. So good for you. You got AI coming. I don't see how that's helping your client, which is the provider. What I want to do is I want to use AI. So when the doctor's in the exam room with the patient, and let's say that patient has diabetes or that patient has two chronic conditions, I want my AI to be suggestive and say, this patient has two chronic conditions. Maybe they're a candidate for chronic care management. Should we proceed? Or if this person is overweight, you've coded this person, you've diagnosed this patient as overweight. You should do you want to do obesity counseling for here, and hit okay. So it's not going to make it, it's going to make suggestions. All those little things add up on that same visit that patient has. So it's going to teach. The AI is going to teach the provider how to make more money.
Yeah. So it's just able to help the practitioner run through the progressions that they would be anyway, right? Like they know these things, but having them retrieved and being able to navigate through them quicker, and it's going to probably minimize some errors somewhere along the way, right?
Sure.
And it ensures the completeness of them going through this like chain of thought. And that's where
Correct.
you're getting the additional, finding the additional opportunities for
Correct. And
treatment. Okay.
all those little things add up. All those little things up. You spend the extra time with the same patient going over mental, obesity, smoking, all these things add up. And it's just extra revenue for the same amount of work that you're doing.
Okay. So you have software. Forward EHR is here or on its way.
It is being built. So we are not in beta yet, but it is we are working on it as we speak here.
So then tell me about the growth of J3. Do you just call it J3?
I just call it J3. It's the worst name, but the more I've had it, the more we've had it, the more I appreciate it. So it is called J3 because J is for Josh. 3 is my 3.0. As I was saying before, I was a retail car business and I was an auto broker. So this is my third integration. That's where the 3 comes from. RCM, revenue cycle management. So J3 RCM. So I've grown to love the name, although I did not love it at first.
I like the idea. Chapter 3.
Yep, exactly. Exactly. We've been very fortunate in our growth. We've a lot of momentum. Uh, LinkedIn has been very good. I'll be quite honest with you. LinkedIn has been very good because it's helped me get the word out outside of my geographic area. I'm in South Florida, and for a long time, 90% of my clients have been in Florida. So now we are nationwide. We do have clients in California, Oklahoma, and it's all been through word of mouth and through networking. Not spent any money on advertising, but that's the way you grow a business successfully. I've always said that I'm in a networking group. If you're not growing your business by word of mouth, you're doing something wrong. So we take it seriously. We have a vow to never lose a client. We did, of course, like anybody else, but so far, 2025, we have not lost a client, and we don't plan on it, and just continue to have growth. I think
Fantastic.
we are great communicators. That's the one thing I say that puts us really above anybody else is the quickness and the accuracy with which we communicate with our clients.
Okay. Well, that's a good segue to what I was going to follow up and ask you about it. So the business is young, right? We're 4, have you
Four
hit
years
5
and
years
some
yet?
change, yeah. 4 years
Yeah.
and 1 month.
Okay. So to get, especially considering like the way that it started to where you're at, it's not an accident. So, what are the things, the either principles or behaviors there's always something behind it, right? It's either, and you can typically tie it back to the leaders, the way that their experience or their strengths or the things that they believe or the way that they are with people. And I mean, the communication, you saying we're great communicators, that aligns with the Josh that I was told about before we met. What are the other things that have been key to bringing J3 to where it's at?
Well, you have to surround yourself with people and you have to create the culture. And I've gone through people. There are people that we had a good feeling about, and it just didn't work out because the passion wasn't there. And yeah, I understand that submitting claims and dealing with numbers and health insurance all day is not the thing that it's easy to get passionate about, but I found people that I try to lead by example. I still have my, roll up my sleeves every day and I get involved and I communicate with my team as to exactly what's going on, who we have that we could be onboarding, where the struggles are. I make sure that we answer emails and texts, and we use every piece of communication possible with email, text, HIPAA compliant app. That when there's a question that our clients have, that it gets answered. So really, anybody can sit here and say, "Oh, I'm a great communicator," but but I really do believe it, and I really believe that when your practice is so reliant on the service that you're providing them, we are the foundation. It doesn't take it lightly. It's not lost on us what it is we're doing. If we don't do our job, the place, a practice can literally have to close its doors if we're not doing our job. So we have to know that how serious it is what we're doing. We have to appreciate that and communicate that to our clients. And when they know or when they feel that we're there for them, when they have their back, it makes for a nice relationship. Specifically, we had a client who all of a sudden abruptly lost their office manager. And when you lose an office manager or when you lose an in-house biller, you're in the weeds, right? You're in the weeds and it's hard to find out. So I was like, okay, what can we do to help you? Not even, they're in Oklahoma. What can we do to help you to get through this until you find somebody else? And they were so appreciative of that. And we picked up the ball on things that we would not normally be doing just to make sure that that they can just concentrate on patients.
So it's interesting, the building a culture and making sure that you've got the right people on the bus and all that. Like when you've done it, you realize that there's a lot more to it than the buzzword. And I'm sure you talk about your mission and your purpose in some way. Like you're attracting people with more than just the actual tasks that they need to do. Then how do you describe the mission or purpose?
They're my differentiator, I would say, from other groups. And certainly we are still, a small fish in a big pond. There are those that are all 100% overseas. And that's tough. Not that there's a bad job being done, but when it comes to communication, when it comes to time barriers, language barriers, it's difficult sometimes for a practice to do that. The worst part about the billing industry is there is zero barrier to entry. Anybody with a laptop can be a biller, right? Sitting at your kitchen table, doing it part time while you're watching your children. There are a lot of companies like that, but we're not like that. We are a business, and we treat our clients' business like it's our own. So if we have a message, is that we are partners. I say that, and I say that when I'm doing my original presentation. Oh, listen, you might not like what I'm about to say, but you and I are now partners. I'm a small percentage partner in your company, and that's how we're going to grow this together.
I love that. You are a business owner. You can relate to the element of their role, or them being a business owner, that like not everybody is as invested in it as you are. And they're probably, if pushed, couldn't tell you anybody who's truly invested in it to the depth that they are. So sometimes it means a lot to hear somebody say like, hey, I'm in this with you. It's a lonely ride.
Yeah.
And you're looking for the people who will be bought in, even if it's not to the degree that you are as the owner. But so when somebody else comes in and says like, hey, I'm going to treat yours the way that I would mine, I think that carries a lot of weight. I mean, I tell my clients, like, I might be the only other person who's going to lose sleep over your business. And that's
Oh,
my way of saying the same thing, that I'm a partner. It's like, I don't want
we've
either one
definitely
of us
done
to lose.
that. Yeah, we've definitely done
Yeah. I don't want, it's not like a badge of honor for us to not sleep.
that. Right.
But the point is, I'm there with
I was told, somebody said to me, said, "You're always trying to be the hero." And I said, "Okay, I guess I understand what you're saying." But then I was like, you know what? I don't mind that. I do want to try to be the hero when somebody's got a big problem. If we take over a practice that is really struggling because the servicing wasn't good before, and they are really struggling, and we can give them a lifeline. I love that. I love being the hero.
absolutely. Yeah, because I think the stakes are really high for that
And
client, right?
sure, of course, of course.
It doesn't matter how good of a practitioner you are.
And I didn't even say this before. It's not a fair fight either. When you are, unless you're a cash pay, practice, it is not a fair fight. You are in the insurance sandbox, and they have all the toys, and they can change their what they want to do whenever they want. And so we have to navigate that. So we have to, it's our mission, anybody that does what I do, or anybody that's in the health sphere of any kind, we have to enable these providers. We have to, we're not socialized medicine. We want to make sure that they're around to take care of the population. So we have to hand them all the tools. We have the ability to hand them. And if I'm just one person and I can do one little thing, then yeah, great. Hopefully there's more people.
Do you find that market, that these private practices are generally receptive to hearing somebody come in and say, hey, you've got to pay some attention to this part of the practice, or it's not going to work?
I ask a lot of questions. And I don't come across that way, the way you think. I ask a lot of questions, and I want the gears to start turning for my clients. And I'm very suggestive and very, soft close type of thing when it comes to making a difference. So, but I'll say, here's an opportunity. Here's how this works, and this is how the math can work out. What do you think? And it's not like you need to do this, you need to do that, because I don't want them to think I'm like a pushy guy and taking over whatever. Again, we're in this together. Here's something that I saw work for one of my other providers. What do you think about this? This might be a good. Or here's an introduction to somebody that does this, that provides this service, which can bring you income, and you're outsourcing. You don't have to hire anybody else for it. What do you think about this? Go talk to them. let me know. I have no skin in the game with that. I'm just going to give you all the opportunities and give you as many tools as I can for you to be successful. So that's kind of my approach to it, is to just offer up my knowledge for anything that, my experience for anything that I can do.
I would suspect that when it's approached well, like you just described, there are going to be some who are still like, that's not what I signed up for. That's not what I want to do. I don't want to deal with this stuff. But there are going to be a lot of them who are, if you can get them the door open just a little bit,
Right.
they're like, I can do things partially and try to stay in this lane and disregard, almost neglect this element, which is really going to hold us back. Or there's a way to do all of this well that I'm not necessarily opposed to. And this guy knows how to do it.
Yeah, there has to be, and there's a word we probably should have used earlier today. There has to be a matter of trust.
Mm.
I'm not going to have, I wouldn't have earned that trust on day one. I may have earned that trust on day 90 of working together, but not on day one. So for me to come barging in and say, you're doing this wrong, you're doing this wrong, you need to do this, anybody would take offense to that. But if we've done the job that we know we can do, 30, 60, 90 days down the road, and then we make suggestions on how to do better, nobody says no. They'll always listen.
So before we wrap up, I want to circle back to the beginning of the conversation. You said that your second wife encouraged you to make a change because and paraphrasing here, but she saw something, there was more to you. There was something else. So what is it? How's it manifesting? Are we seeing it now?
I'm 60 something years old. I wish I knew then what I do now, but I'm not that guy that says I should have did this, I should have did that. I'm not doing that, because I really believe that your experience gets you to where you are, and you have to live your life before you can get to this point. I wish I was more of an entrepreneur instead of a W-2 person. I wish I had learned that sooner, but that's about it. I love working for myself, and I never thought I would. And it comes from guidance. To be frank, I had a stepfather who we weren't engaged that much. Now, we had a bad relationship, but he wasn't a guide. He wasn't a guide. So you need guidance, and I've learned to be able to do that with my children. And when you have that, when you have somebody that's going to guide you, that somebody sees your potential, and somebody that has faith in you, it changes everything about you. And really, because of that, we're in good shape over here.
Thank you so much for listening. If you found the show valuable, you can say thanks and show your support simply by taking a quick second to like, share, and comment on the show. You can also find more information about each of my guests, all of the resources from the show, and myself at nickberry.info/TBOJ.